Routine venipuncture is the most common blood collection procedure for a phlebotomist. Venipuncture can be performed using two methods, the syringe method and the evacuated tube system or ETS. The syringe method is often preferred over an evacuated tube when drawing blood from patients with small or fragile veins. The advantage of this system is that the phlebotomist is able to control the suction pressure on the vein by slowly withdrawing the syringe plunger. Another advantage of this method is that blood will appear in the hub of the needle when vein has been successfully entered. The materials or equipment needed for venipuncture are the following: syringe, tourniquet, cotton, gauze pad, bandage or micropore tape, sharps container, 70% isopropyl alcohol or alcohol swabs, and gloves. The following is the stepwise procedure on how to perform venipuncture. Introduce yourself. Identify the patient. All patients are called into the phlebotomy area and ask their name and date of birth. This information must match the requisition form. Explain the procedure and gain consent from the patient. Verify the patient's condition and check for any allergies.
Allergic to latex or adhesives? Hindi po.
Assemble the necessary equipment needed for the procedure. Wash hands and put on gloves. Position the patient with the arm extended to form a straight line from shoulder to wrist. Apply the tourniquet 3 to 4 inches above the collection site and select the appropriate vein for venipuncture. When looking for a vein, it's better to have one that you can feel rather than see. Never leave the tourniquet on for over 1 minute. Release the tourniquet after selecting a puncture site. Clean the puncture site in a circular outward motion using a 70% isopropyl alcohol pad. Allow the skin to air dry for 30 to 60 seconds before proceeding. Do not touch the puncture site after cleaning to avoid recontamination. Perform the venipuncture. Reapply the tourniquet and remove the cap of the syringe. With the thumb of your free hand, pull downward from below the intended puncture site to anchor the vein and tighten the skin. Holding the needle in line with the vein and with the bevel up, forward through the skin at a 30-degree angle or less until you perceive to be in the center of the vein or until a flush of blood is visible in the hub. Draw the desired amount of blood by slowly pulling back on the plunger. When enough blood has been obtained, have the patient open his fist. Release the tourniquet. Place a gauze pad or a cotton over the puncture site and quickly remove the needle. Immediately apply pressure. Ask the patient to apply pressure to the cotton for at least 2 minutes. When bleeding stops, apply a fresh bandage, gauze, or tape. Dispose of the syringe and needle into an appropriate sharps container. Transfer blood drawn into the appropriate tubes as soon as possible, as a delay could cause improper coagulation. Gently invert tubes containing an additive according to its number of required inversion. Label tubes and confirm with patient's armband or requisition. Remove gloves and wash hands with appropriate antiseptic. Thank the patient and give after instructions when necessary.